All right, so now we discuss positive and negative relationships. Uh, there is a difference between positive and direct relationships, where both variables vary in the same direction as compared to negative relationships, which are inverse relationships, right? So we can say that as education increases, income increases. That is a positive or direct relationship. Both the variables are moving in the same direction. So increasing the value of one variable is associated with an increase in the value of the other, meaning if we increase the education level, we will see an increase in the income level. Um, Another example as given on the slide is increase in income level is associated with an increase in health insurance coverage, and there can be lots of examples like that. Now the negative or inverse relationship, the variables vary in opposite directions. So increase in one variable is associated with a decrease in another variable, right? So increase in education level is related to decrease in smoking habits. So if a person is, let's say, bachelor's or graduate degree holder, they are less likely to smoke as compared to people who have less than high school education, and then that group is more likely to smoke. So that is a negative relationship. Then we look at the strength, symmetrical or asymmetrical, and linear and nonlinear relationships. Strength is basically the coefficient that you get when you run a regression, and the strength reflects how much the variables are related, right? So we say that income is related with education, or education is related with income, but we don't know how much, right? So when we run the regressions, which we will see in the later part of the semester, and we find coefficients, let's say 1 unit increase in education leads to a 2.4 unit increase in income, which means probably like if it's multiplied by, let's say, $100, then we can even say that $240 increase in income is associated with 1 unit increase in education, with maybe probably like 1 extra year of education. So that is showing the strength of the relationship. The more two variables are related, the more accurately we can predict that the change in one variable can cause a change in another variable. Symmetrical says that change in either variable is accompanied by a change in another. So if the first variable is changed in any shape or form, there is a change in another variable. However, asymmetrical says that change in one variable is accompanied by a change in another. However, the reverse is not true. So you can increase the education level, and that can lead to increase in income. But if you increase the income level, that might not lead to increase in education. So if people are making a lot of money already, they probably don't need to go back to school, right? They don't need to go back and get more education. However, the first relationship that we spoke about, that is very much true. If a person is wanting to get more income, they want to get more education. Linear says two variables vary at the same rate. Example, relationship between pack of cigarettes smoked and chances of getting lung cancer. They are varying at the same rate. Okay. Um, so if there is a lot of cigarettes that are being smoked, then there is a higher chance of getting lung cancer. That is a linear relationship. But a nonlinear relationship is in which one variable changes is different for different values of other variable. So again, for education and income, that's a very good example of non-linear relationship. Now there is a tipping point, right? That is the point of diminishing returns. As far as education goes, you can get a lot and a lot. You can get like 10 PhDs. Is that going to give you more income? No. So only there is only a maximum point at which it starts diminishing, and you can get one PhD or one master's education, and then that will only go so far to increase your income, but after that your income is not going to increase anymore. Causal relationships, there are requisites, which means statistical association. There should be sequence of influence and non-spurious relationships. The two variables must have a statistically significant relationship or correlation. Those are the basic. These are the basic requisites for causal relationship, and there should be a clear cause and effect sequence. So causal factor must occur first. So poverty and disease, for example, right? So if there is people who are living below the federal poverty line, they are more prone to disease because probably they're homeless and they do not have access to better food and water and health care. And so the causal factor must occur first. So poverty must occur first. Causal relationship says that they are easily determined for asymmetrical relationships where the cause precedes the effect in time, because it is time related, right? Only when a person is poor and has spent maybe like 2 or 3 years in poverty will they start experiencing diseases. They may not experience diseases on the first day of poverty. They have to be poor for a few years or maybe a few months before they start experiencing diseases. So the time effect is there when it comes to causal relationship, and that is why it is easily determined for asymmetrical relationships. We cannot say that if you have a lot of diseases that will increase your poverty. You can be very wealthy and you can still have a lot of diseases. The next thing in terms of foundationals is specify the theory. Specify the theory as applied to a phenomena which you are trying to investigate. Theories are based on observations and they rather than on deduction from existing theories, which are also known as grounded theories. We have to be very sure that we are founding or basing our or if that is the correct word, like kind of grounding our experiment into a theory. It can be an organizational theory, such as institutional theory or even resource dependence theory. Resource dependence theory basically says that hospitals are dependent on resources in the environment to sustain. And a lot of my papers, for example, are based in resource dependence theory. It is very difficult to establish causality in social science research because there is a lot of other factors such as behaviors of people, their mindset, and so forth, which are included in social science and behavioral research. There's limitations of existing theories that may not be sufficient to identify the proper causes, and you apply social science such as health services research, and that has developed from practical needs and problem solving. There is imperatives of theory development which are less critical than there is the need to solve problems that arise in the real world. So theory development might not be so important. It is important for scientists, but what is more important is solving the problems in the world that are going on. So if there is existing theories that are limited, right, and they cannot sufficiently explain your causes or your experiment, it is fine. You can still go ahead and conduct the experiment. Health services research examines how people get access to healthcare, how much is the cost of care, and what happens in terms of outcomes, right? In terms of outcomes of the care. So it produces knowledge about resources, organization, financing, provisions, and policies of health services. So you gain a lot of understanding of how health services is paid for, how it is delivered, and what are the outcomes. So health services research is a study that addresses, as a definition, it addresses the planning, the distribution, the organization, quality, effectiveness, and efficiency and outcomes of the delivery of healthcare services. So HSR is influenced by The expanding role of federal government as a major financer. As you know, Centers for Medicaid Services provides reimbursement to hospitals, and hospitals cannot go very far if the reimbursements are cut or diminished. And so federal government is a very important influencer in terms of health services research. So this is also a federal agency. Um, Agency for Healthcare Research and Quality. They support research that is designed to improve the quality and safety and efficiency and effectiveness of healthcare for all Americans. They're a driving force, and they shift from traditional fee-for-service systems to managed care networks, so HMOs to PPOs. There's a drive toward quality and outcome, and that provides impetus to HSR. They develop and test the practice guidelines. For example, the volume outcome evidence. Increased volume of patients can result in poor outcomes. That evidence has been brought by AHRQ. And it also says that patients that are undergoing various types of complex treatments have lower mortality rates and better outcomes if care is provided in hospitals that have a high or a heavy caseload of patients with the same conditions than if care is provided with institutions with lighter caseloads, so they don't have to manage a lot of complexity and case morbidities, and so the outcomes in those hospitals can be much better. Outcomes research, some examples are mortality, performance of a system, financial performance of a system, and for example, Avedis Donabedian's 1996 paper evaluating the quality of medical care, that used the term outcome first, and that became part of the quality assessment framework, the structures, process, and outcomes, the SPO framework that was initiated by Donabedian. So outcomes research tries to understand the result of particular healthcare practice and interventions, and it has become the key to develop better ways to monitor and improve the care quality. So for clinicians, and on the clinical side, outcome research provides evidence that can be used as evidence-based practice and make informed decisions. And HSR has applications in the operations of healthcare delivery systems, and that includes managed care. So the goal of outcomes research is basically to measure tangible events that are experienced by patients, such as mortality and morbidity. HSR has a lot of contribution toward evaluating the impact of medical care services, such as planning physician manpower, workforce planning, payment systems of hospitals and physicians, if there is any altering that needs to be done, implementation of finance systems, evaluation of alternative healthcare delivery systems, for example, acupuncture, chiropractor, naturopathic drugs, and so forth, critical assessment of new technologies and pharmaceutical drugs, also examining disparities, right, racial, ethnic disparities in groups, and assessment and improvement of quality of care by using evidence-based guidelines. Scientific inquiry is philosophical foundations that go beyond the subject matter. They have to use ethical standards. They have to maintain objectivity. We have done this, in the previous video, but this is a recap. They are not theory driven, and there's limitation of available data for research, and that can contribute to difficulty in conducting health services research. It's a multidisciplinary field. We make use of different branches of social and biomedical sciences in health services research. It may be considered as the application of biomedical, social, and other scientific disciplines, such as demography, where we see population size, composition, and growth rates; anthropology, where we look at qualitative research in the context of qualitative research; economics, because we are looking at cost benefit and cost effectiveness ratios. And so to gain a full understanding of health services and populations, we need to incorporate all of these multiple disciplines into health services research. But health services is also very population based, right? Because there is a lot of populations living in specific areas. which, let's say there is, a certain African American population living in Nevada, or Hispanic population living in certain parts of Nevada, who are more prone to diabetes or cardiovascular diseases. So the population health is the one that we specifically look. In recent times, we have been researching more of that in health services research, and that differentiates health services research from other health related research, right? Like, for example, epidemiological research and others. Epidemiological research also provides conceptual foundation for health services research. It's a very applied field because it is defined by practical problem-solving orientations. We do conduct data analyses, we form theories, we have frameworks within which we work, and we also provide knowledge. We generate knowledge through health services research that can be applied to specific populations. It is also based on the concerns that are in the real world, in the society. So specific issues like AIDS, mental illness, heart disease, and programs like community programs, breast cancer awareness, for example, or diabetes awareness, environmental programs, occupational and international health programs. All of these are a part of HSR. So the products of HSR are assessed in terms of their usefulness, if they can be used by clinicians, administrators, governments, programs, and policymakers. Health services research is related to health policy research, and health policy research is the process of scientific investigation that applies methodologies from health and social sciences to evaluate health policies. The goal of health policy research is to improve population's health status, and program development and implementation and evaluation. Work of policy research is related to work of policymakers because the work that is done in health services research informs policymakers to assess maybe a program, or see the cost effectiveness of it, or see the cost benefit of it, or evaluate it, right? The process of HSR is what refers to the activities that bring an end result or product. So operationalization, if I can ever say that word correctly, are the general concepts that are converted to specific indicators or variables, and there are procedures to identify and concretely measure those variables. For example, health status can be operationalized as number of doctor visits and hospitalizations days per year, and it can be observed by examination of the world regarding what is seen and heard. And for example, you can count the number of doctor visits, you can count the number of hospital days, and that is operationalizing the health status of a certain group. Conceptualization, I've said that many times, but it is using theories and building a conceptual framework using, let's say, a theory. For example, institutional theory that I told you in the last video says that hospitals mimic the behavior of other institutions to have a strategic position in the environment and in the marketplace. So we use such theories. First, we determine the specific research topic, and then we look at relevant theories that can be applied. Then we specify the meaning of concepts and variables that are to be studied, and then we formulate general hypotheses or research questions. All of this is a part of conceptualization of the paper. Then you use groundwork, which requires researchers to identify relevant data sources. You explore potential funding sources, if there is any funding that can be used. You develop a research plan or proposal to obtain that funding, and you prepare organizationally and administratively, which means that you clear IRB, you get the funding, you make sure that all the ducks are in the row to carry out research. Researcher needs to choose the appropriate methods for a particular study. So they use a general strategy for studying the topic of interest, which includes doing a literature review, which can include meta-analysis. You also use qualitative research, which can be of phenomenology, mixed methods, and case studies type. Or you can do an experiment in the lab. You can also do a survey, including longitudinal study, meaning year by year survey, and then you can also do evaluation methods. These are different types of methods. We don't have to go in the detail of each of those because we will be covering those in the later part of the semester. A research design is an overall plan or framework for investigation. It addresses the plan of scientific inquiry. You also expect what the other stages or the subsequent stages of the research project will be, meaning you kind of start expecting what is to follow, and then you identify the unit of analysis. In most of health services research that I do, I use hospital as the unit of analysis, and then you measure your data at dependent or independent variables. Dependent and independent variables were covered in the last video. You also establish procedures for data collection, and then you develop a analytical strategy. You also create a sample. You must be clear about the population of interest. So you create a sample. So let's say you get 500 hospitals in Nevada to respond to your survey, or 500 hospitals, probably not just in Nevada, but between California, Nevada, and let's say Arizona, to look at how hospitals' financial performance is on the West Coast and the Southwest, and so you use all of those 500 hospitals as a sample. So your sample size is 500 hospitals. Measurement is done in operationalization stage, where you devise measures that link certain concepts to observable events or variables. You also want to make sure that the validity and reliability of measure is made sure, is ascertained, and researchers should be knowledgeable about guidelines and writing techniques for survey instruments. Then you collect data, so that involves gathering of empirical data. There are certain data collection tools. You can use interviews, telephone interviews, face-to-face interviews, or you can use a survey, or better yet, you can use data that is already collected by somebody else. So for example, the American Hospital Association is an association that collects data from hospitals all over the United States, 6,500 hospitals, and that is much easier way to obtain data. So you just buy the data from them, and that is what we do from our department. We buy data from AHA, and we as researchers use that secondary data set. And because we are using secondary data set and it is publicly available, we don't have to clear IRB. So that is an advantage of data collection from secondary sources. Data processing is when data is difficult to analyze in the raw format. We want to clean it up and we want to make it more manageable. So raw observations are typically in the form of questionnaires, when they have to check responses. So we want to start coding and classifying them. So let's say a survey is answered in the Likert scale from 1 through 5. So we start coding it and giving a response of 1 or an answer of 1. For let's say employees are not satisfied, we give them 1. Employees are moderately satisfied, we give them 2, and if they are highly satisfied, we give them 3, right? So we give them all these scores, and then we calculate percentage scores. All of that done is if the survey is in a Likert scale or something similar. Data analysis employs statistical procedures to manipulate the processed data. Conclusions can be drawn, which also ties to your hypotheses that you have developed and your research question that you have developed so far. So researchers should be knowledgeable about descriptive and analytical statistical procedures, and we'll cover that also in the later part of the semester. And that knowledge is important to facilitate independent research, and that is how you can improve your research design and measurements. Then looking at application, funnel stage looks at the interpretation of research findings. Now that you have your findings, you start interpreting it, and then you communicate your findings through a report or publish it in a journal. You can also communicate it through media, conference, or you can even write a book. So you provide suggestions for future research on the subject when you write your discussion, and you also outline the limitations of the project that should be avoided in future studies. So for example, let's say you used only one data set. So not using one data set is not a disaster, but it is not a good idea because that can result in limited generalizability of results. You want to use a couple of data sets, merge them together, and that leaves you with a more enriching set of results and findings. In conclusion, the aim of scientific inquiry is to produce and enhance knowledge, right? So health services research believes in social regularity, like we have said before. We always look for regularities and patterns. We are not looking for exceptions, and both are empirically oriented. HSR is empirically oriented. Practical orientation of health services research comes from its emphasis on solving problems and producing knowledge. So it is considered a social scientific inquiry, and that can help in gaining better understanding of health services resources, health services delivery, cost, efficiency, outcomes of patient care, and so forth. Thank you. And that brings us to the end of Foundations of Scientific Research.